The athletic training student will instruct the patient to be seated with their legs supported in full extension with the ankle at a 90 degrees dorsiflexion throughout the entire taping technique. The ATS will then apply tape adherent, a heel and lace pad to the dorsal aspect of the ankle and to the Achilles along with pre-wrap. The ATS will then use 1.5 to 2 inch non-elastic tape and place 2 anchors around the lower leg at the base of the gastrocnemius muscle. They will then use 1 anchor around the midfoot, making sure to cover the base of the 5th metatarsal. The athletic training student will use moderate roll tension to prevent constriction as the foot expands upon weight bearing. In the case of an inversion sprain, the ATS will start the first stirrup on the medial lower leg anchor, proceed down over the posterior medial malleolus, going across the plantar surface of the foot and continuing up and over the posterior lateral malleolus with moderate roll tension. They will then finish on the lateral lower leg anchor. The ATS will then begin the first horseshoe strip on the medial aspect of the midfoot, continue around the distal Achilles tendon, across the distal lateral malleolus, and finish on the lateral midfoot with moderate roll tension, proximal to the 5th metatarsal head. The ATS then starts the second stirrup on the medial lower leg by overlapping the first by half of the tape width, continuing down over the medial malleolus, across the plantar foot, up and over the lateral malleolus, and anchor on the lateral lower leg. The ATS begins the second horseshoe on the medial forefoot and overlaps the first by half of the tape width. ATS then starts on the medial forefoot, applying a third horseshoe overlapping the second. The ATS then applies a figure of 8 technique over the dorsum of the foot, continuing under the longitudinal arch, around the midfoot proximal to the base of the 5th metatarsal, and then angles the tape upward, encompassing the distal lower leg. They then will repeat the figure of 8. The ATS anchors the lateral heel lock across the lateral lace area at an angle toward the longitudinal arch, continues across the arch, then angles the tape upward and pulls across the lateral calcaneus with moderate roll tension around the posterior heel and finishes on the lateral lace area. The medial heel lock begins over the medial lace area at an angle toward the lateral malleolus and continues across the posterior heel, then angles the tape downward and pulls across the medial calcaneus with moderate roll tension under the heel and finish on the medial lace area. They will repeat the lateral and medial heel locks, and the ATS will apply closure strips around the distal lower leg, angle the tape to prevent gaps or wrinkles. The ATS will apply 2 to 3 closure strips around the midfoot and a medial to lateral direction with mild to moderate roll tension remaining proximal to the 5th metatarsal. The ATS will then document the tape job and verbally explain when they should discontinue use.